Hi guys, welcome to our gross anatomy lecture. Today we're going to talk about lymph drainage of the whole upper limb. Lymph drainage of the whole upper limb. Right, so the lymph is actually divided into superficial lymph and deep lymph. The superficial lymph is the lymph that will be within the superficial fascia. The deep lymph is the lymph that's going to be moving along the deep vessels. For example, moving along the brachial artery, ulnar artery, radial artery, and so forth. So let's start with the superficial lymph. Take note of this. All the lymph of the upper limb drains into axillary lymph nodes, which we spoke of in our axilla lecture. But today we're going to just go through them again. Is it good? So you're going to have five lymph nodes, five groups of lymph nodes in your axilla. Let me start with this one. You're going to have your anterior, or called pectoral, that will drain lymph from the lateral portion of your breast, right? And also receive lymph from your anterior abdominal, your anterior lateral abdominal wall above the umbilicus, right? And then you're also going to have your posterior group of lymph nodes, which are also called your subscapular lymph nodes. These they drain lymph from the back of the back, from your back up or superior to the iliac crest. And then you're actually going to have a lateral or a humeral lymph nodes. These are lymph nodes that are going to be medial to your axillary vein, and this they drain most of the lymph, the deep lymph and the superficial lymph of your upper limb, mainly the medial portion. So lymph from the medial portion, right? So let us take a look. So you're going to have a lymph coming from the third, fourth, fifth vessel digits, and the medial portion of your upper limb, draining first into these cubital lymph nodes. Cubital lymph nodes. These cubital lymph nodes, they are also called supratrochlear lymph nodes. So they will drain lymph from the third, fourth, fifth of the digits, medial portion of the hand, and medial portion of the forearm, and they drain into these cubital lymph nodes or supratrochlear lymph nodes. These lymph nodes, they'll continue, right, and send efferent vessels that will actually drain into the medial, into the lateral axillary lymph nodes. You understand? So lymph coming from the medial portion of your upper limb will drain into your lateral axillary lymph nodes right here. So the anterior, posterior, lateral will actually drain into the central axillary lymph nodes, and the central axillary lymph node will actually drain into the apical lymph nodes. Take note of this. There's another group of lymph nodes which is a deltopectoral group, or called your infraclavicular group. So we also have a lymph coming from the lateral portion of your upper limb, right? So that is a lymph coming from your second, your first digit, your lateral part of the forearm, of the arm. This lymph will travel along the celiac vein, enter the deltopectoral groove, drains into the deltopectoral lymph nodes, which are your infraclavicular lymph nodes. These lymph nodes, they will actually end up draining into your, into your apical axillary lymph nodes. And then from the apical axillary lymph node, this apical axillary lymph node will actually be sitting at the lateral margin of the first rib. And then they will drain into your subclavian lymph trunk. And the subclavian lymph trunk of the right drains into the right lymphatic duct, which will drain into the confluence of the internal jugular, the right internal jugular vein, and the right subclavian vein. And if it is to the left, the subclavian lymph trunk will actually drain itself into the thoracic duct. Let's take a look at another diagram. Right, so this is a beautiful diagram showing a part of your hand, your forearm, and a part of your arm. So you're actually going to have a lymph from your lateral portion of your hand and your forearm running along the cephalic vein, right? And they end up draining into the infraclavicular group, or called the deltopectoral group. And then you have a lymph from the third, fourth, fifth, and middle portion of your hand, middle portion of your forearm, draining into these cubital, or supratrochlear, or epitrochlear lymph nodes. These they will end up draining into your lateral lymph nodes. Let's take a look at another closer diagram. Right, so here you can clearly appreciate your axillary lymph nodes right here. So lymph from the lateral portion of your arm will actually drain into your infraclavicular nodes right here, because it will be traveling with the cephalic vein, and they will end up draining into the apical lymph nodes right here. And then lymph from your middle portion, remember we said the third, the fourth, and the fifth drains into your cubital nodes, which are your supratrochlear or epitrochlear, that will run along with the basilic vein and drains into your medial or humeral lateral your lateral or humeral axillary lymph nodes, right? These are going to be your anterior, that will drain a portion of your breast, especially the lateral quadrant. These are going to be your posterior, will drain the skin above the iliac crest of the posterior body wall, and then they will all drain into the celiac lymph nodes, and then end up draining into this, what we call the apical lymph nodes. Good. So as for the clinical correlates of lymph, you have what we call lymphadenitis, lymphadenitis, right? Uh, this is due to inflammation of the lymph. So you're going to have infection of lymph vessels, right? That will lead to inflammation of these lymph nodes. So inflammation of the lymph node is actually called lymphangitis. Right. So it's actually called lymphangitis. Sorry for that, lymphangitis. Um, that is inflammation of your lymph nodes. So we also have lymphadenitis, which is actually dilatation of these lymph nodes due to infection. So thank you so much, guys. See you next time and take care.